yeah, all right. So we're recording and start timer. Five. All right. Hi, I'm Melody Tillier. I'm a physician assistant student. I'm going to be help taking care of you today, okay?
Okay.
And before we get started, I just want to confirm your name and your birthday.
Casey Joyce, January 31st, 1998.
Okay, Casey. So Casey, tell me what brings you in today. What's going on?
So for the past 2 days, I've been having some abdominal pain.
Okay.
It's gotten pretty bad over the last, I would say like 2 days.
Okay. It's gotten pretty bad over the last 2 days, and you said it's in your abdomen. All right. So when it came on about 2 days ago, what did it feel like? Was it really sudden, really gradual? Walk me through what happened.
At first, it was pretty gradual, and then recently it got like a sharp pain.
Okay. Sharp pain. Okay. And when you have that sharp pain, have you noticed it radiating anywhere?
Yeah, it's actually going more towards my right side, on the lower right side.
Okay. All right. Okay. And since you had this starting 2 days ago, have you like did you maybe eat anything? Did anything happen that you think maybe brought this on?
I noticed it right after I was eating breakfast. So it was in the morning. I just had gotten done eating a bowl of cereal, and then I just noticed my stomach started hurting, and then like it got progressively worse and worse.
Gotcha. Okay. Yeah, that doesn't sound very fun. It sounds kind of scary and worrying, right? Um,
Yeah.
since it started, have you tried anything to make it better?
I've been trying to like lay down, and like when I hunch over, it does feel a little bit better.
Mhm.
Um, but nothing, I mean, I took a little bit of ibuprofen.
Ibuprofen.
Yeah, like 2 tablets a day.
And how did that go?
It helped a little bit, but I'm still having a lot of pain.
Okay. All right. And how about what makes it worse?
Definitely walking, just in general, standing up straight and trying to walk.
Okay. So it seems like exertion, kind of
Hmm.
doing anything strenuous or even just mild daily activity.
Yeah, pretty much
Mhm.
daily activity.
Okay. All right. And you said it has gotten worse over the last 2 days, or did you say it's kind of stayed the same?
It's definitely gotten worse.
Okay. And have you ever experienced any type of abdominal pain like this before?
No.
No, never. Okay. Okay. And when you have that pain, you said it's a sharp pain. On a scale of 1 to 10, 10 being the worst pain you've ever had in your entire life, what would you rate that pain?
I would say like a 9 or 10. It's
A 9 or a
really,
10?
really painful. Yeah.
Okay, gotcha. And when it's, you said it, when you walk, it makes it worse, or when you exert yourself.
Hmm.
Um, when you do that, does it go all the way up to a 10? Does it stay about a 9? Where are you at then?
Usually when I'm walking is when it's like about the 10. And then I like when I said and I lay down, it gets to be like a little bit less, or like kind of like hunched over or like on the couch kind of. But other than that, yeah, it's gotten extremely painful.
So pretty bad anyway, and then when you do things, even worse.
Yes.
Okay. All right. And have you noticed any specific time it's better or worse as far as during the day, such as when you wake up, when you go to sleep, anything in that realm?
Mostly during the day, it's the worst because I'm up kind of walking around doing normal activities. But I would say at night, it's probably the most painful because that's when I'm like trying to go to bed and I'm having a hard time sleeping because it's just so painful.
Yeah, you feel like you're very aware of it kind of because
Hmm.
you want to go to sleep and you can't.
Yes.
Gotcha. Okay. Is it interfering with your sleep at all, or are you able to finally go to sleep at some point?
I am able to go to sleep eventually, but just that initial like trying to lay down has gotten a little bit difficult.
I see. Okay. With this abdominal pain, have you had any other symptoms that you're aware of or that you've noticed?
I felt a little bit nauseous and
Hmm.
I was vomiting twice yesterday.
And with the nausea and vomiting, was it did you kind of feel queasy for a while and then you wound up vomiting, or was it very sudden, very quick?
I was feeling a little bit nauseous, and then I vomited right after.
Okay.
And then same time when I did it again the second time yesterday.
Okay. Okay. And you said you vomited the second time yesterday. The first time, was that the day that this started?
Mm-hmm.
Just to clarify. Okay. So and have today now is the third day. So have you vomited at all today?
No, just
Oh,
yesterday.
and any nausea today?
A little bit,
A
yes.
little bit of nausea. Okay. Okay. All right. So let's see. I'm going to ask you a couple more questions just regarding, you know, the symptoms that you said with abdominal pain and everything, just so we can get kind of a clearer idea of what's going on. So are you having any type of trouble swallowing?
No.
No. And how about any heartburn?
No.
I know you said you had nausea, but is your appetite the same or has it decreased? Any changes?
It's decreased a little bit just because I feel like when I did vomit yesterday, it was right after I ate. So I'm like not too tempted to eat because I'm in a lot of stomach pain at least.
Yeah. And you feel like maybe you're a little bit worried that if you do eat, you're going to wind up vomiting again?
Yes.
Okay, I see. All right. And how about, any changes in your bowel movements?
No.
No. And how about, stool color and size? Does everything seem normal there?
Yes.
Okay. And you said no changes in your bowel habits or having regular bowel movements, which is great. Any pain when you use the bathroom?
No.
No. Okay. And how about, have you noticed any type of blood or black stools?
No.
Okay, good. And any hemorrhoids?
No.
Okay. So everything seems normal. So no constipation or diarrhea either with that vomiting and nausea?
Yep, just the vomiting and nausea
Okay,
and the stomach
great.
pain is just the main
Okay.
issue.
Okay. And you're noticing, you said that you vomit after you eat a lot of the time in the last 2 days, but do you feel like you're having reactions to any specific foods?
No.
It's pretty general.
Hmm.
Okay. And how about any extra burping, anything, gas, any?
No.
Okay. And let's see. And have you noticed that maybe your skin looks a little yellow the last couple of days at all, or your eyes look a little yellow?
Not that I've noticed.
Not that you noticed. Okay, great. And any trouble with your liver or maybe your gallbladder?
No, I don't think so.
Okay, great. And anything with hepatitis, any history of that or any concern?
No.
Okay. All right. And then I'm just going to ask you a couple more questions. I know this seems like so many questions. We just want to make sure that we're able to narrow down what's going on so we can get you the proper treatment.
Sure.
Let's see. Okay. All right. And since you've been vomiting, I'm going to ask you just a couple questions about your mouth, your throat. How's the condition of your teeth and your gums?
I would say they're good.
Okay. And how about any bleeding gums?
No.
Okay. Any, do you wear any dentures?
No.
Okay. And you go to the dentist regularly?
Yes.
When was the last time you saw your dentist?
I think I had my last cleaning 6 months ago.
Okay, great. And any sore tongue?
No.
No. Any dry mouth?
Nope.
Okay. And how about any frequent sore throats or hoarseness?
No.
Okay. Great. Okay. All right. I'm going to ask you just a few more questions about yourself just so we can get a full comprehensive history on you. That way we can, make sure that we are certain with what's going on and we can get you feeling better so you can, eat a meal and go about your day. Okay.
Yeah.
Let's see. All right. Do you take any medications?
I just take birth control. That's it.
Birth control? Okay. And is that an oral pill?
Yes. Once a
Okay.
day.
Once a day. Okay. Do you happen to know the name of it?
Yeah, it's Crisel.
Crisel? Okay. Okay. And do you happen to know the dosage or no?
I do not.
Okay,
Yeah.
no problem. Don't worry about it. Okay. And how about any allergies?
I have seasonal allergies, mostly just during the springtime.
Okay. Spring allergies. Okay. And how about any allergies to any foods that you're aware of?
No, not that I'm aware
No.
of.
And how about any medication allergies?
No.
Not that you're aware of. Okay, good. Okay. All right. I'm just going to ask you a couple questions just about your childhood and your health when you were a child. If you want to tell me a little bit about that, that would be great.
I think everything was pretty normal. No major past histories in my childhood. I did have eye surgery,
Mm-hmm.
I think when I was maybe like 10.
Okay. Do you know what it was for?
I saw like double vision,
Mm-hmm.
so I'm not sure exactly, they just like corrected the double vision.
Okay.
I think it was my right eye.
Okay, in the right eye.
Mhm.
Okay. And any complications with that surgery?
No,
No? Okay. And I'm hoping no double vision, right?
no, yeah,
Okay, great.
everything's good, and no glasses, which is good.
Glad to know the surgery was successful. That's always a good sign.
Yes.
Okay. I'm just going to ask you about a couple common childhood illnesses just to confirm any history of measles.
No,
How about mumps?
no,
Okay. Rubella?
no,
Okay. And any whooping cough?
no,
No. How about chickenpox? Did you have those?
no. My
No.
brothers did, but I never did.
Okay. Did you get the vaccine for it?
Yes.
You did? Okay, great. And how about any history of rheumatic or scarlet fever?
No,
No, neither. Great. And how about diphtheria? Do you know?
no,
Okay. And you're young, so I'm guessing probably not, but polio?
no.
Okay, great. Okay. And so just that eye surgery, nothing else, no chronic childhood illnesses to speak of?
Nope.
Okay. And let's see. And how about now? How's your health now overall?
Now I would say it's pretty good. Everything else is normal. It's just these last 3 days is when I started noticing something.
Okay, great. I'm just going to ask you about a couple common, adult illnesses just to confirm. Like I said, this will seem like a few questions, but just quick yes or no if you have them. If you don't, great. Any history of diabetes?
No,
Great. And how about high blood pressure?
no,
No. Any hepatitis? I know
no,
you said no before, right? Okay. Any HIV?
no,
Great. And how about COPD?
no,
No. Okay. Any asthma or history of asthma?
no,
No. Okay. And how about thyroid issues?
no,
Okay. Any history of cancer? Any concerns of cancer?
nope,
No. Okay. How about any heart disease or coronary artery disease?
no,
No. Okay. And how about any issues with your kidneys?
no, I don't think so.
Everything's great. And any history of any type of blood clot?
No.
No. Okay. Wonderful. Okay. And you said you got that surgery when you were young on your eye. Were you
Mhm.
hospitalized for that or was it outpatient?
It was outpatient.
It was outpatient?
I was under anesthesia, but it was just like one day.
You just went in, got the surgery, went home. Okay.
Yep.
Have you ever been hospitalized for anything?
No,
No? Okay. And any major accidents to speak of or any major injuries?
no,
Okay. No broken bones, nothing like that?
never broke a bone.
Very
Knock
lucky.
on wood.
It's not fun, let me tell you.
Yeah.
Okay, and then you had that eye surgery. Okay. And you said you were 10 years old. And when you recovered, everything was good recovery, easy, not painful, or
Yep, everything was good.
okay. And do you happen to know the name of your doctor or no? Do you not remember?
I don't. I was really young at the
Yeah,
time,
I
so
figured. I figured I'd ask
time
though.
ago.
Yeah, your parents probably know, right?
Yeah.
Um, okay. And any history with psychiatric services at all? Any, mental illness, any concerns?
No.
Okay. And in the last 2 weeks, have you ever felt down, hopeless, lost?
No.
Okay. And any thoughts of harming yourself or others?
No.
No? Okay, wonderful. That's all good. Yeah, I just have to ask all my patients these things because mental illness is very common, unfortunately.
Yeah, that's okay.
Yeah. And you said no previous contact with psych services, so any admission history?
No.
Okay, great. All right, and then I'm just gonna ask you a few things just about your menstrual history, if that's okay, just so we can get full understanding of your health, especially because you're having abdominal pain. Is that okay with you?
Yeah, that's fine.
Okay, great. So are your periods regular, if you don't mind telling me about that?
Yeah, everything's regular. I only think I take birth control and keeps it pretty regular.
Okay. Any complaints with that that you can speak of?
No, I have like common cramping sometimes, but other than that, it's pretty normal.
Okay. And with that cramping, is it severe or it's just kind of,
I would say
what you
it's
expect?
mild.
Mild? Okay.
Hmm.
Okay. Does it ever keep you from doing anything that you want to
No.
do? Okay. That's great. Good. Okay. All right. And I'm just going to ask you now some questions about your health maintenance. I know you said that you saw your dentist about 6 months ago, which is great.
Hmm.
I'm just going to ask you if you're up to date on your vaccines. I'm going to just list a couple common ones. If you know you've had it, if you could tell me when you had it and if any reaction. Okay. Do you have a current tetanus shot?
Yes.
Okay. Do you remember when you last got it?
I think about 3 months ago.
About 3 months ago? Okay. Very good. Any reaction to that?
No.
No? Great. And did you get the whooping cough vaccine? Maybe you know as
Probably.
pertussis?
I think so, yeah.
Mm-hmm. How about diphtheria?
Yes.
Okay. Polio?
Probably, I think
Most
so.
likely? Okay. And so far as you know, there's no reaction to any of these?
No.
Awesome. Okay. Do you know if you have your MMR shots for measles, mumps, rubella?
Yes, I do.
Okay. You get the flu shot?
I do.
You
Yeah.
do? You get it every year?
I do. I haven't gotten it yet this year, but that's on my to-do list for sure.
It's on mine too. Don't worry. It's still a little early in the year. You're
Yeah.
okay. And you said you got the chickenpox shot, which is great. Um, how about your hepatitis B shot?
Yes.
Yeah, you have that one. Great. How about Haemophilus influenza B? Do you happen to know?
I'm not too sure about that one.
Not
If it's
sure.
like a
Okay.
regular one, then probably.
Yeah. It's usually a lot of my patients aren't sure if they have it. Don't worry. It's not uncommon for you to not be sure. There's a lot of things on this list. How about the pneumonia shot?
Probably again, yeah.
Okay. And how about herpes zoster? Think
Um, I would think so. If it's like a
probably.
normal one, yeah.
Okay. Did you get your meningitis vaccines?
Yes.
You did? Okay.
Mhm.
And
Yeah, I
how
know
about
what
the
it is.
HPV?
Mhm.
HPV? Okay. Very good. We'd like to see that. Okay. And did you get a TB test anytime recently?
Yeah, I just got one about 3 months ago. I did
Mm-hmm.
the two-step TB
Okay.
test.
Okay. And what was the result of that?
It was negative.
It was negative? Okay. Very good. And you're pretty young, but have you gotten a pap smear yet?
I have, yes.
You have? Okay. And when was the last time you got one?
I think it was last summer, so about a
Last
year
time?
ago.
And how were the results?
They were normal.
They were normal? Okay. Do you
Mhm.
happen to know if they had screened you for HPV when they did the pap smear?
I believe they did, yes.
You think so? Okay. Awesome. And you're too young for a mammogram, so we don't have to worry about that. And let's see, colonoscopy too young. What about cholesterol? Have you gotten that checked recently?
Not that I know of. I don't think so.
Okay. When was the last time you got a physical with your regular doctor?
About 3 months ago?
Okay, 3 months ago. All right. And did they do blood work on you then?
Yes.
Okay, but you don't think they checked your cholesterol?
I'm not sure. I don't think so.
Okay.
Maybe
It's
if it
usually,
was, if it's included, then probably, I'm
okay.
sure it was fine.
I don't think that they check it necessarily on everybody. It kind of depends on the doctor.
Okay.
And I'm gonna now ask you just a few more questions about your family history, okay?
Okay.
So we can get a full understanding of your health. Is there any history in your family of hypertension, or that might be high
Um,
blood pressure?
my mom has high blood pressure.
Your mom, okay. And how does she do with it?
I'm pretty sure it's controlled.
Yeah, okay,
I
no
think she takes
major.
a medication,
Okay,
pills maybe, oral pills.
something. Okay. How about any family history of coronary artery disease?
No.
No. Okay. And any high cholesterol?
I think my grandmom did.
Grandma? Okay. Okay. And is she still living or has she passed?
Yeah, she's still living. I
Yes.
want to say she's about 85.
Good for her. Wow. How about any history of stroke in the family?
No.
No. Okay. Any history of diabetes?
Not that I know of. I don't think so.
No. Okay. Any thyroid issues with anyone?
No.
Okay. And how about your kidneys? Anybody in the family have kidney problems?
No.
No. All right. And any history of arthritis?
No.
No. Okay. Any history of TB in the family? Tuberculosis?
No.
No. Okay. How about any asthma or lung problems?
No, I don't think anybody has asthma.
Okay. Great. And any history of headache or migraines?
No.
No. Very good. Any history of seizures?
No.
Seizures? Okay. And I know you said that no mental illness for you. How about anybody in the family?
No, I don't think so.
No. Okay. And no history of suicide either?
No.
And how about any history of substance abuse or addictions?
No.
No. Okay. And any major allergies in the family that you know of?
My dad's highly allergic to bees.
Bees? Okay.
Mhm.
Okay. And other than dad, nobody else?
No.
Wonderful. Okay. And how about any history of cancer in the family?
My grandmom had colon cancer,
Hmm.
but I think everything's okay with that now.
Okay. Is that the same grandma with the high cholesterol?
Yes,
Okay. And is that mom's mom or dad's mom?
my mom's mom.
Mom's mom. Okay. And how's she doing with that? Is she doing okay?
Yep, she's totally good now. Pretty sure everything is better.
Great. Okay, good. And other than grandma, nothing
No, I think that's really the only thing
with cancer?
that I
Okay.
know of, at least.
All right. And any genetic disorders that you know of that run in the family?
No.
Okay. And I know you said your grandma, your mom's mom, she has history of colon cancer, high cholesterol. How about your other grandparents? Are they still living?
Yes, my other grandmom is alive, and then both of my grandfathers have passed.
Oh, I'm sorry to hear that. Um, if you don't mind me asking, when did your grandfathers pass? How old were they?
My one grandfather passed when I was fairly young. I want to
Mhm.
say when I was around 5. So I'm not,
Okay.
he was, I want to say in his 60s. I don't think he was that old.
Okay.
So I was fairly young. And then my other grandfather, I want to say he was in his 70s.
Hmm.
I was fairly young for him too. So
Okay. And which one was mom's dad?
the one that passed when he was like 70.
70. Okay. And how about your dad's mom? How is she doing?
She's good. I would say she's around like 80 and she is in fairly good health.
Great. I always love to see that when we have our grandparents and they're in great health.
Yep, both my grandmoms are always running around and don't act like they're 80.
It's always really nice to see. My grandma's the same way.
Hmm.
Everyone says, wow, look at you. It's so great to see you. and she's so happy. So that's always very good. Okay, I'm gonna ask you just a few questions about a couple things. I always ask my patients all of, whoop, that was it.
Okay.